everyone, I'm Darlene Young from Arlington, and I'd like to welcome you back to another segment in our program series, Mindful Health Alternatives, that appears here on CAT TV monthly on Channel 15. The goal of this series is to introduce you to a different and less stressful lifestyle through several different methods. Our guest today is Mary Bradley, who is a physical therapist from Hoosick Falls, New York. She also treats lymphedema. I met Mary several years ago, and she also has been helping me with lymphedema therapy. So I figured I would snag her and get her here to talk about lymphedema therapy. And I'm not only going to have her here for one show, but I might get her here for two more. So I've alluded to at least one more, but I think I can get her back for two more. So welcome, Mary.
Thank you, Darlene.
You're quite
nice
welcome.
To be here.
I'm glad you're here. I want you to know that if you think you might have lymphedema, it's a swelling of either your arms or your legs after you've had surgery. And Mary's going to talk to you about the different types of surgery and why you might get lymphedema. You have to be referred to Mary or to someone who's certified to treat lymphedema by your physician, and then you can be treated for it. So without further ado, let's get started. And Mary's going to talk to you about the causes of lymphedema, the symptoms, and the treatment. So Mary, welcome, and let's go.
Alrighty. So lymphedema is really a very underdiagnosed disease. It is a disease. It's not an illness. It's not like a cold. It's a disease, and it is something that needs to be managed throughout the individual's lifetime once you've been diagnosed with it. It is a kind of a difficult disease to diagnose. There's not a real lot of knowledge or teaching in many programs regarding the lymph system and the importance of it. I'd say now it is growing, but I know back years ago people were not introduced to it, and many times it went left untreated with really severe complications. So when we hear about the lymph system, we really primarily think about lymph nodes. Mm-hmm. Everybody's heard of swollen nodes in your neck, your tonsils, or under your arm, your groins. And as soon as they're swollen, we seek medical attention because they should not be inflamed or swollen. So that sometimes is what gets people to the physician in the first place. Sometimes that resolves. It's just an infectious process, and your lymph nodes are enlarged because they're fighting that infection. It goes away. Many instances, it doesn't go away, and then we're dealt with the symptoms that Darlene spoke of, where primarily I think people think of lymphedema as someone who has had breast cancer and has had a mastectomy for the most part. Lots of times in treating the cancer itself, we have to remove lymph nodes from the axilla. And then we'll notice people start getting a larger arm with swelling, and it just kind of continues to get larger and larger, and people really don't know how to manage that. That's a secondary cause of lymphedema. There are congenital causes. People are born with lymphedema, and that's primary lymphedema. So there are two types of lymphedema. There is a primary, and that is there's quite a bit of that, but the most common causes from lymphedema are secondary. Usually it's attributed to cancer treatment, having lymph nodes actually removed. Many times just a surgery where there's been a deep wound in an extremity or somewhere, and the lymph vessels are damaged so they can no longer function like they should. Lots of times there is in most of the courses that you'll take, there's a common in the tropical areas, people get what's called filariasis, and that's caused by a mosquito that carries a little worm on it, and that worm gets into the tissue.
Wow.
And it's very prevalent in the tropical areas, mm-hmm. Whole families, because they aren't able to sort of eradicate that problem.
Okay.
So that's really common. I actually read an article in the Times Union a couple months ago, maybe 6-7 months ago, where there was a man who lives around Albany, and he was in the military, and he has lymphedema as a result of filariasis, the worm. So it's not unheard of here in the United States, but it's not seen nearly as much. So we primarily see as a result of cancer. Many times we'll see as a result of a combined lymphedema. So it's combined with venous insufficiency. So people who have issues with their veins, usually in the lower part of their legs, the veins do not push the fluid back up, and then that overloads the lymph system, and so it's like a combined, a mixed lymphedema. So that's basically what you'll see. If you go online, and don't freak out, but if you go online and you happen to look on several websites for pictures of people with lymphedema, many of them are very overwhelming. You know, they show people who have severe lymphedema at a stage that's called elephantitis, where, you know, the limb is just like sometimes twice, 3 times the size of their own, the opposite leg. There's open areas. It's very disfiguring. So it can get to that stage. I personally have not seen that, but I have, you know, I know many people that have worked with people like that, and you can help it with treatment. The biggest thing to get out of this is that if you have lymphedema, you need to seek treatment, because the treatment is technically the cure. You're not going to cure it, but you're going to manage it and be able to live with it, and you would be surprised at how much you can help it and reduce the swelling and provide comfort, move around easier. So
now the fluid that accumulates is not just plain water. It's like a protein-based type fluid.
What happens is you get, it's a protein-rich fluid. So the extracellular fluid within the circulatory system, there's a lot of water in that, and so the lymph system helps to carry away protein, extra protein in our system to keep a balance, because it can deal with larger molecules than the veins. So what happens is the water and the protein bind together, and so you have a high protein edema. That causes most of the problem, because the high protein, then you get hard edema. It's not soft where you can squish it, and usually elevating it, it'll go away. The hard edema forms, we call it sclerosis or fibrosis. So you start to have collagen, like actual tissue that's laid down, instead of a nice soft matrix where things can flow through. The protein starts to clog things up, because it's not as pliable, so you're not able to push the fluid up.
Okay.
So you see oftentimes people's legs, so they're like a woody appearance. You can see oftentimes people will have little like warts, or they call them papillomas, or hyperkeratosis, where there's little growths, a lot of creasing. So the actual physical makeup changes as well. Okay. So the massage helps to reduce some of that.
So when, you know, like I was first diagnosed, I mean, like the doctor, you know, like I think I had taken like diuretics, but I wasn't getting any satisfaction of like the leg going down. So the diuretic wasn't helping at all, as far as I was concerned.
There's some controversy out there, and it's really dependent on the person, but in most instances, the literature will tell you that diuretics usually are not recommended for lymphedema, pure lymphedema. If you have a systemic issue where you have bilateral edema, if it's cardiac or kidneys or something, you know, an organ-related thing, then that's when you'll use diuretics. That's not to say that they're not used with lymphedema. They can be used, but oftentimes you pull out the water and you still have protein left behind. So now that protein is going to bind to whatever other water is left. So you're still, it's not really going to, it doesn't really seem to help with managing lymphedema.
Okay. Thank you.
Yeah. So, and lymph fluid is clear. So when, you know, you don't necessarily see it, or if sometimes people's legs become so tight and the skin so rigid that any kind of little cut or nick or any injury to that skin will cause that fluid to leak out.
That's what I was just going to ask you. I mean, if it gets so tight, is it going to burst and cause it to
Well,
leak?
sort of.
Okay.
That's what, yeah. So it's the only place that the fluid can go is the skin actually breaks and develops, or blisters develop, and then they ooze, and it's usually a clear fluid. Lymph that is around the stomach, there's probably like 200 to 300 lymph nodes actually in your stomach. There's like 600 to 700, I think, throughout your body. Different sources say different things. Actual lymph nodes, and then there's a whole system of capillaries, just like you would kind of look at your venous system or your arterial system. The problem with the lymph system is the valves are only one way. So when I have a vein and it pushes fluid up, the vein comes back down, and the fluid cannot go back down. With a lymph gland, it's just it pushes up, and that's it. There's no other mechanism. So if there's more pressure going down, it's going to push that fluid back down. So I'm not able to keep progressively pushing it up.
Okay.
And so that's why I say to you all the time, or anybody now, I use the analogy that's used a lot in courses of, in order to clear the lymph fluid, I start very far away from where the area the problem is. So if the problem's in your leg, I'm starting up here doing a massage, and people are like, what are you doing? You know, the problem's there. They think you're supposed to start down, massage fluid up. We're actually opening up channels to drain it in. I tell them it's like a little car traffic jam. So if I have a traffic jam of fluid down here, I'm not going to push it into the jam. I'm going to open up, let these cars flow out, and then push the cars. So it's a very, very specific massage. You follow a very specific route or a pathway, and it's a pretty comprehensive evaluation to let the therapist know which pathways I will use with you versus, you know, depending on, are my lymph nodes intact, are they not? Because I have to reroute sometimes.
Now, each person is different. I mean, like if what you do with me is going to be different than what you would do with someone else that comes in with like bilateral leg edema. Yeah, I may have someone that's had, like if I've had somebody that's had an open area. I've had one patient who had actually a pretty large open area in her thigh, so we had to go around that. I don't want to push more fluid into that. So instead of following the normal pathway, I had to come up with how do I move that fluid away, yet get it back up to the circulatory system, back up to the heart to be redistributed where it should be. So you do have to, there's a little bit of puzzle work involved. Now, do you see more people with lymphedema, like from breast cancer survivors, than with leg?
No,
or is it?
I probably have, in my experience, I've seen more people with leg edema.
Really?
Definitely.
Seriously?
Yeah.
Wow. Okay.
And it's well, because I think with the leg edema, it's a mix. I think there's venous insufficiency. So people who the veins just become incompetent and they no longer are able to exert the force to push the fluid back up, coupled with the lymph system, then that just impacts the lymph system negatively. Breast cancer is much different because you know, there's studies out there that somebody could have 2 lymph nodes removed and develop lymphedema. There's no specific number of lymph nodes. You could have 23 lymph nodes removed and not ever have an issue.
Really?
It just, it's just sort of the luck of the draw.
So, in order to get a lymphedema, I mean, if they do just like a, how do I want to say, a lumpectomy, if they don't remove any lymph nodes, then chances are they won't get any lymphedema?
Probably not, but again, when you do a lumpectomy, probably not as much. But if you do a mastectomy and still there are no lymph nodes removed, there's also the issue you could have truncal edema. You're not necessarily in your arm, but many people get it right around the breast area and the trunk. Because that's been all cut, you've taken out a lot of deep tissue, you're getting nodes out, you know. And so I've had several patients that have had mastectomies and they begin with trunk edema. And so I want to combat that so that
Sure.
it doesn't go to the arm.
Yep.
So the biggest thing is to, I think there needs to be some not necessarily prevention, but some awareness that if I know I'm going to have a mastectomy, I hopefully want to get to my doctor and say, let me see somebody right now before anything is done, and let's measure, let's get some baseline stuff done. Let's know what exercises I should do and what to look for, and what can I do post-mastectomy. Do that all before my surgery,
Sure.
so then I've got something to compare to.
Sure. I mean, we are starting to do it with like the Look Good, Feel Better program. I mean, before you start your chemo, you go and let a cosmetologist look at your hair to get an idea of what color wig you're going to use.
Right.
So you might as well work with a physical therapist, or to see your measurements for the lymphedema.
Right. I mean, it just and there's so much that people don't. It's just nice to know. You know what? There's this resource that I can go to, and if I have questions, even if they seem like absurd or put your mind at ease. That's huge with your healing. This is normal. This is not normal. This is, to be expected. So this is what we can do. Once you've had lymph nodes removed, once you've had any injury to any and actually men are not immune to lymphedema. Very common after any type of testicular cancer. If they remove lymph nodes in the groin area, many men develop lymphedema of their leg. So that's something that it's not gender neutral.
Okay.
It can happen to anyone. The biggest thing, I guess, to prevent lymphedema, I'm not necessarily sure you can prevent lymphedema because it's like so hit and miss, but there are things you can do to maybe slow the course of the lymphedema or help with your treatment. If you're going to commit to being in a lymphedema program with a therapist, it's a commitment.
Yep, it is.
Sometimes it's 5 days a week.
Yep.
For an hour, 2 hours to begin with. It's a very lengthy treatment. Sometimes it's weekends. But the biggest piece is, the therapist is only with you for that 2 hours. You have got to manage it the rest of that time and be very diligent with what's recommended and the protocol. There's really four components to a decongestive therapy program, and they are skin care is huge, the actual manual lymph drainage, the massage, compression bandaging is a component that's very important, and then exercise is huge because you want to exercise to keep that pump going and just for the health benefits. And I like to say education is huge. So sometimes you may spend a whole session just on education, and this is what's going on, and this is why, and this is what you can do, and this is what I'll do. There are some therapists that actually have patients sign an agreement that
Really?
we're in this together, and it's very labor intensive.
Yep. I think working with you was the biggest commitment that I have made. I mean, I've been in a couple of different programs, and I mean, I think I just got frustrated with some of them and just said, I just can't do this. But I think I've worked with you the longest, and like I went through many containers of Vaseline because Vaseline is one of the best skincare things, and then like at home using the electric pumps on the legs. There was many nights you'd go home from work and just put yourself into the pump machine and plug it in and just veg for a while.
I mean, there's two phases to the whole decongestive therapy program, and the first one is the edema reduction. We want to get that edema down as much as we can, and that's a collaboration with the therapist and the patient. And then there's maintenance, and that is now becomes the patient's primary role, and the therapist sort of plays a back seat. You're a resource. You're going to say, come in once a week, come in once a month, call me, come back in 6 months, we need new stockings. So the goal is to get through a very intensive 4, 5, 6 week program, get the edema down to where it's plateaued. Now I can get you in something to keep it there. Now you're going to follow through and, you know, keep everything maintained. And when there's a problem, then you have a resource, and you know, you may resume again. You know, interestingly, I can say I haven't seen really, I've been certified, I want to say 2 years, maybe 3 years now. And the biggest thing the biggest reward for me is that people are not in and out of the hospital. It's amazing. I've had several people that would have cellulitis once a month, and then they'd be in the hospital, and I mean on expensive IV drugs, doing therapy in the hospital, big hospital stays and big costs. And that's one of the benefits of managing it, is you can do it as an outpatient most times, and you will see just everything else improve. All other aspects of your life will improve. So that's what I think is the biggest benefit.
Good. Now, something I was reading, and I didn't know that, you know, I always thought you needed to have like a mastectomy or like a hysterectomy or something, you know, to interrupt the lymph nodes. But somewheres I was reading, if you had surgery and you had radiation, it could, the radiation can interrupt the lymph nodes as well and cause lymphedema?
Well, radiation is just damaging to the tissue. So what happens is, essentially the radiation, most times it's deeper, and what you're seeing on the outside, you're seeing, you know, redness, burning of the tissue. That's also occurring, you know, underneath your killing cells, you know, so, but you'll see people get that hard skin. And so you lose that nice, pliable, the elasticity of the vessels that are transporting that fluid, and so it accumulates. So radiation is a very common cause for lymphedema. And it doesn't occur, that's the other, with lymphedema, you know, there are people that will have a mastectomy, have 2 lymph nodes removed, have no radiation, and then a year down the road they have lymphedema. There are people that'll have a mastectomy, no radiation, 23 nodes, no lymphedema, ever. And then there may be somebody that has a mastectomy, radiation, and then 30 years down the road you'll see it. You know, it doesn't happen.
There's no rhyme or reason.
Yeah.
Wow.
What happens is your system, as soon as there's been an insult to the system, something's been damaged, you're considered to have stage 0 lymphedema. So that's where it's reversible, you can maintain it, and you kind of keep an eye on it. So you're always going to have lymphedema. What happens is, over time, it just depends on your system, and as the system can no longer transport all that fluid, the other take over for the damaged area, so it's not able to take over any longer, that's when you start to see the edema happen. So it can happen, just depends, you know, it just depends.
Now, with the infections, I know in here it talks about infections. Cellulitis is an infection, and it can go really quick. Because I know I've been there, done that, and you said, you know, the minute you get your trigger, you know, do something about it. Something causes the cellulitis, some sort of infection causes the cellulitis. So according to what I've read, that it can also raise issues with the lymph nodes or the lymphedema too. Why is that?
Well, usually and it's difficult to tell if you have a cellulitis sometimes with especially in somebody with lymphedema, because there's already skin changes, the tissue has changed color, so usually you have a darker leg already, but you know, we all know, like, medically the signs of infection are redness, heat, pain. So when you see any of those, then you think cellulitis. Lymphedema is not usually a painful situation, Most people complain of an aching around the area. It's heavy, but they don't usually say it's painful in the way that we traditionally think of pain. So when you see someone who has a warm leg and you feel it and it is definitely redder, sometimes we'll mark the redness to track it, and if it's progressing, you definitely want to get a hold of your physician. The skin with lymphedema is so brittle, and it's so susceptible to being opened because, as it expands, it just kind of, it doesn't burst, and I don't want anybody thinking it's going to be like a bursting of water all over, but you get oozing, and so bacteria can get into those areas. If you have skin folds and you have cuts or chafing or any of those sorts of things, you can get bacteria into those areas, and that's essentially what causes the infection.
Okay.
And that requires antibiotics, and that requires, if somebody's actively has cellulitis, we do not do a massage. So that's an important, give and take between the therapist and the patient. You can still compress, but people with lymphedema or any kind of skin issue like that are definitely susceptible much more to a cellulitis.
Okay. Okay. So there's a lot going on, and they also say don't go barefoot.
Yep. I want to, if somebody actually has lymphedema or thinks they have lymphedema, first of all, you want to consult your primary doctor and, go from there. But there's a lot of internet use in every facet of our lives today. I think what people need to do is understand when you're getting stuff off the internet for anything, make sure your resource is a peer-reviewed, it's a good resource, it's a reputable resource. So having said that, I get most of my stuff is off of the National Lymphedema Network, and there's several of them, and you can find those, but just make sure, when you're reading something about anything that, you take whatever it is with a grain of salt, unless you see that there's been studies around it, research, who's doing the research, are the people paying for the research that are supporting the product, or so you want to be careful. But I've gotten a lot of stuff off of the National Lymphedema Network. They have position papers that I tell most people to go to, and they speak to healthy habits for people at risk for lymphedema. Skin, there's a whole huge thing on skin. There's diet, and that's an interesting one, diet. Weight management is huge with lymphedema because you're just kind of stressing an already stressed situation. So I can't say for sure what particular diet is good or is recommended. I've been to the course that I went to, people were talking about, they were doing studies into a high-fat diet, which seems totally unhealthy to us, and we were all sort of blown away by that. And then I watched the video, and it's like high-fat, but it's not processed.
Okay.
It's naturally occurring fat that has been on the planet for years.
Wow. Okay.
That's one thought. The other thought is you need a low protein because it's a high protein edema, so you want less protein.
Right. Right.
I haven't found anywhere, and I do know that many of the lymphedema researchers are really, that's one of the aspects they're looking at a lot now, is diet and lymphedema. So that hopefully sometime they'll come out with something that'll say this is the best diet, or components of a diet.
Sure.
With a diet, I think it's hard for anybody to be really stringent, but I think it's a healthy diet. Medical checkups should be done, in a what's the word I want to use, like a regular manner.
Okay. Regular basis.
You want to be checked out, every so often, just to monitor where you're at. There are actually skincare. Meticulous. Skincare is huge. You want to make sure that your skin, if it is dry, you moisten it. Because drying leads to cracking, cracking leads to bacteria getting into the tissue, that leads to cellulitis. Bare feet, that's exactly why. It's funny when Darlene mentioned Vaseline. That's probably one of the best for someone with lymphedema. If you don't have a lot of open areas, you just put the Vaseline on I use a lot of it, depend if I'm wrapping somebody. But you want to really moisturize. No, you don't need a lot of perfumes. Very low pH, balanced soaps and lotions. But lotioning's huge. Drying between toenails. Toenail care is very big with lymphedema because people they tend to get a lot of fungus and those kinds of things. So that's very, very important. Exposure to sun is important. You do not want to get burned. Burned, blisters open. Then we're going to, we're at risk for infection again. If you're going to use insect repellent, I would be careful with, as we would anyway, what ingredients are in the insect repellent. Shaving, you need to be careful shaving legs, don't nick your legs, so those sorts of things. Most of the skin care stuff is around preventing an infection, not to nick or cut it. They'll say if you go out in the garden, you like to garden, wear longer gloves or long sleeves, so you don't get rose bushes that, or that sort of a thing. Air travel is somewhat, I don't know that it's controversial, but there's different opinions on that, because when we fly, the pressure changes, and so we want to be mindful that if we have lymphedema, it may get larger because of the change in the pressure. So most times they'll recommend that we always you wear your garment when you fly, and for either several days before or several after. Once you get into compression garment, for most people it should be worn 24/7 off an hour or two. So it's part of your day anyway. But there's, there's a position paper on air travel on this website.
Really?
For people to look at.
And also, like with women that have had a mastectomy or even a lumpectomy, like when they have blood pressure checks and blood draws and stuff like that.
You want to, that again, it has been a bit controversial more recently. Definitely I wouldn't want somebody doing a blood draw. You're just always, if you can, get something done on the other arm if it's not involved. I've had people, both arms, take the blood pressure in the leg. You can get a leg blood pressure, if you feel like you're nervous about it. If you were going to have your blood pressure checked multiple times, I would make sure that it was done on the other. You can get a bracelet, lymphedema bracelet, so that people will know that. The other thing is like tight sleeves. People are like, be careful if your watch is really tight, wear it on the other arm. You don't want to constrict because many of the lymph vessels are superficial. They're very close. There's deep and superficial. So if you're constricting those, you're just cutting off that flow. So you want to, that's, kind of, those are pretty basic things that we tell people. Prolonged inactivity, making sure you're up and you're down, because just sitting, not moving. The muscle pump is really what helps move fluid up in our legs, because the veins are really all we have, and if the veins are becoming tired, weak, incompetent, and can't, then that muscle pump is what helps. And that's the rationale for compression garments, is they help push the fluid up once we've gotten it down. So, moving around, making sure you're, exercising. Exercise is huge. And people with exercise are like, I can't do this. I can't. Most exercise is okay. I would have, make sure that somebody, like a therapist, knew what exercise I wanted to resume. I've had people try yoga after mastectomies, and it really bothered them, and they couldn't do it. So we find something alternative, water, exercise. So there is, there are things you can do to continue to exercise.
And even if you, if you can't do like a lot of leg exercises, if you're lying down, you can always do your toe thingies,
Anything that moves fluid, potentially. Breathing, deep breathing, I think people just neglect breathing with everything in a meaningful, you know, way. So when breathing is a big part of the lymphedema treatment, deep breathing, because you have tons of lymph nodes in your stomach and the surrounding area, and you want to get those opened up. And so breathing is just good for relaxation, but it also helps move fluid, helps pump, gets the muscles moving around your ribs and your sternum. So it really, breathing's a very big component. The one thing I do want to say with exercise is I know there's a lot of people out there now that use those foam rollers.
Oh, those noodle things?
Anything hard foam,
Yeah.
and they'll use it to roll or lay on or something. Be careful with those with lymphedema, because that's compression.
Oh, okay.
So I've had a couple people that I wanted to do some of that stuff with, and I didn't do it.
Oh, okay.
I'll use something softer, but be careful of a harder surface as well, because sometimes that will really cause some issues.
Okay.
So what else? Let's see. That's really, you know, there's so many. That's why I think it's important, even, you know, if anybody's going to have a surgery and there is the slightest chance that, you know, lymph nodes may be removed, radiation's involved. I have a patient that has had uterine cancer, and she has abdominal lymphedema, and it's really, really uncomfortable. And she went for quite some time without anybody really telling her what to do, and she thought that's what she had to accept, that this was going to be painful. You know, sitting was horrible for her. She couldn't do a lot of her stuff that she used to do. And I've seen her 3 or 4 times, and it's, you know, her world, in some small way, is better.
It's better.
You know, just by doing some compression, showing her stuff to do. So, you know, if you think there's something up, talk to your doctor, and it's worth at least being seen. You know, I've seen 1 or 2 people, I'm like, you're fine, you know. I don't need to see you ever again unless something really happens. But for the most part, you do need to see people. And, you know, insurance covers most insurances. That's a whole other story. But most insurances will cover its physical therapy. It can be billed as physical therapy. Occupational therapists that are certified can bill. A massage therapist cannot bill for lymphedema therapy. But so for the most part, if you work with a PT or an OT, they can bill for it with your insurance. The garments are a whole other story. They're not covered well. There's a whole. I got Darlene involved in a advocacy group, and it's the Lymphedema Treatment Act, and actually they have like 200 co-sponsors in the House now. They're trying to get garments paid for any lymphedema diagnosis. Now they are paid very intermittently by Medicare with a diagnosis of breast cancer, and breast cancer patients can get maybe 2 to 3 bras a year. Pretty much other than that, you're out of luck. If you have leg issues, you have to have open wounds. So the coverage isn't the best that it should be. The garments are expensive. They're very expensive, but they are very effective. So, you know, there are some funds out there for people that will help cover garments, but that is probably the final piece. That's really going to be the most important piece, is using the compression once you get down, and continuing with that compression lifetime usually. And it's a big undertaking, but it beats the alternative of, you know, because without any treatment it is going to get worse, and you're going to, you know, eventually cause more problems that are going to be globally medically impair you.
So we have just you know, some final wrap-up thoughts that Mary will do here in just a couple of minutes. If you have questions, you can get a hold of me, and I can give you Mary's telephone number, or Mary can just give you her telephone number as she's summing up the different thoughts. She's at Eastwick Physical Therapy.
Someday we'll do a show on why it's called Eastwick.
Okay. And she is in Hoosick Falls. she would be glad to answer questions for you if you get her secretary, or if you get her voicemail, just leave a message with your name and your telephone number and she'll get back to you and answer your questions. She's good at that, and she is very knowledgeable about this. I had actually a friend that had tripped over something in the snow several years ago and had some swelling on the ankle, and thought it was just, like swelling. And come to find out it was lymphedema, and had some x-rays done, and there was nothing broken, but the doctor said, well, maybe it's lymphedema, and person saw Mary, and Mary, diagnosed it, and the person is doing great now, has a garment that she wears, and is going to go back and see Mary after she has her hand surgery here in a couple of weeks, and that's healed, and get back into the garments and get back into the swing of things. And the swelling did go down before, and it will go down again, and she will be compliant and behave herself.
That's the hard part, is to, every day it's a struggle. To, spend maybe 20 minutes taking care of your skin, and then another 20 struggling, and I mean struggling, putting on a garment. Some people really, really struggle, and they're hard to get on. Next time there's all kinds of little ditties out there to help get garments on, but that's the mainstay of it. There's also, what I just got to thinking, we see people who, lymphedema, and I don't know if people have heard of lipedema, but lipedema is a very interesting, it's a female prevalent type of lymphedema. But what you'll see is there is usually no involvement at all at the feet. The person's feet look totally normal size, and then as you look up the legs, they become swollen, and they're quite large, and then that is also treatable, and usually that just involves compression. But if left untreated, again, I've seen people that get open areas just because of the tissue just breaks down because it becomes so swollen. So, you might say, usually lymphedema presents as one side more than the other. If it's a cardiac or usually a systemic issue, you usually see bilateral swelling. And that's usually resolved with laying down. It's usually resolved with diuretics. There's usually a fix for that. Lymphedema does not go away once it progresses to the stage of irreversible and starts getting that hardness. It does not go away with medication usually. It's an actual physical treatment that needs to be used. I really love this. People think I'm bizarre, but I really enjoy treating people with lymphedema. I think it makes a huge difference in their life. Just to be able to, move easier, feel more comfortable. Your whole perception of your image changes once you've dealt with it and can manage your edema. So I think it's underutilized, and hopefully we can get a little more awareness that there is help out there. And I know there's several other therapists in Bennington area, Rutland, maybe Manchester, that are certified. But you want to make sure you go to a certified therapist, because it's a pretty involved, it's a long training course, and it's a lot of knowledge, and you want to make sure that fluid is being moved correctly and where it should be moved. And
good.
Is that it?
That's very good. And you can bring your shorts with you too. And
Yes.
it's nothing like when it's a real cold day, you come out of there in a pair of shorts because you're nice and warm,
You're all
because
snuggled up.
everything's flowing pretty good. Your system's all revved up. So I'd like to thank Mary again for being here, and she will be back at least one other time, hopefully two. The next time she comes, would like to show some treatment options that she does. Maybe get some, maybe a couple of pumps, and show you what the pumps look like. Do you have like a movable bed? Or you
Oh,
could,
yeah, I do.
Or you
I
could
do.
borrow Jody's or
Yeah,
something.
yeah, I do.
And I mean, if you need
Yeah.
a person, a model or something, I don't care. I've done it before for Jody or whatever.
Yeah. Yeah.
So we will be back again in the future, and we will talk some more about lymphedema. And don't be afraid. You know, you're not going to show her an arm or a leg that she's going to gasp at. She's here to help you. And if you can't get to Hoosick Falls because of transportation problems, she can probably let you know of somebody that might be closer to you. Or, you know, maybe your physician knows of somebody that is closer to you that can help you. So I want to thank you for tuning in to Mindful Health Alternatives, and it's good to be back with you. And we would like you to tune in again, and we will see you again. If you have any questions or comments or ideas for future presentations, you can contact me here at CAT TV at 802-442-8868, or contact me by email at darlene@catamountaccess.com, all small case letters, and let me know. So thanks again for tuning in to Mindful Health Alternatives. We'll see you again next time. Thank you. Bye now.
Thank you.